If I could ask you as we get started to please enter your name, your organization, and your state. Oh, except we don't have chat, so maybe do it. Let me see if I can. Let me see. Is chat working for anyone? I can't tell from my. Oh, it does look like it's working. Okay, so if you could enter your name, your organization, and state in the chat or in the Q&A, if the chat isn't working for you, that would be great. If you're having trouble with Zoom, message Eva Panetta, and Eva, I see that you have your hand up. Let me just
Kim,
check.
it should be working now.
Okay, excellent. Thanks, Mary.
Yep.
Okay, but it looks like folks are using the Q&A function too. Oh, thanks everybody for just rolling with the technology issues today. Okay, so we're going to try and get to your questions at the end of the call today, but please feel free to submit questions throughout using the chat box or the Q&A function. You know, depending on how much time we have left, we'll answer as many questions as we can on the call, and then we will also follow up by email. All of you registered with us, so we have your email addresses. We will send responses to the questions along with the recording after this call. Okay, if you joined just by phone and didn't enter a participant ID, you can link your phone line to your web presence by joining. You can do this. So select join audio from the bottom menu bar, then follow the instructions, enter your participant ID. Hopefully this isn't going to be too much of an issue for folks. Use *6. If you're on your phone, you have to use *6 to mute and unmute, but let's just kind of enter most of the questions in the chat. So hopefully we won't need the audio as much. Okay, we're going to walk through an overview of Superior Health Quality Alliance. Then we'll talk more specifically about the Community Health Disparities Reduction Partnership Grant, talk about eligibility and requirements, outline the process for the RFP, and then we'll get to questions. Okay, so first, who we are. Superior Health Quality Alliance. We're a relatively new entity. The organization was formed in 2018. We're an alliance of 8 healthcare quality improvement organizations that work across 6 states. We're primarily working to improve the quality of health and healthcare for consumers, patients, clinicians, and communities under the umbrella of the broad national CMS Medicare quality strategy goals. So here you can see our mission: quality of health and healthcare, effectiveness and efficiency in designing and implementing quality improvement initiatives, really focused on patient-centered care and integration across the continuum of care, with a goal of, or a broad vision of achieving better health, better care at a lower cost, and also creating a better healthcare worker experience. We do this with the values of integrity, innovation, quality, and diversity. Here you can see the 6 states that we work across. The Superior Health Quality Alliance is made up of 3 organizations that have historically served as Medicare QIOs, Medicare Quality Improvement Organizations, 4 hospital associations, and then our 8th partner is the Midwest Kidney Network, which has served as the end-stage renal disease quality improvement contractor for our region. And we're happy to provide more information about Superior Health if you're interested. Okay. We're as the QIO, the Quality Improvement Organization for Michigan, Minnesota, and Wisconsin. We're in the midst of a 5-year contract with Medicare to achieve a set of goals across the continuum of care. The contract goes through October of 2024, so we have just over 18 months left in the contract. Our goals focus on a variety of cross-cutting topics. So care coordination, which is really focused on preventing unnecessary hospital utilization. So preventing those readmissions and unnecessary emergency department visits. Improving management of chronic conditions. So diabetes, hypertension, and chronic kidney disease. That also includes a focus on cardiac rehab and smoking cessation. We're doing a variety of work, probably obviously, as we're just kind of coming to the end of the public health emergency on infection prevention and control and emergency preparedness. Both, we're doing a lot of work in nursing homes, but also working with communities on that. We'll obviously be talking today about our work to reduce health disparities and advance health equity. We're doing work to increase the rate of immunizations for flu, pneumonia, and COVID. And then we're also doing some work on improving medication safety, in particular related to opioids. So that's a kind of a broad overview of the work that we're doing. This just helps to show that we're doing all of that work, as I've mentioned, across the continuum of care. So we work with hospitals, clinics, nursing homes, home health facilities, public health agencies, kind of a whole variety of folks who make up community coalitions across our 3-state region. We have some cross-cutting priority focus areas. So health disparities is one of those, but we're also looking to improve quality of care and access to care in rural areas. We have a person and family advisory council that we use to incorporate the perspective and experience of the patients, families, and caregivers into the work that we do. And then we're always exploring opportunities to incorporate and leverage health information technology into the work that we're doing. The only thing I'll add here is that in addition to the health disparities work that we're talking about today, we're also doing work on the implementation of the class standards, so culturally and linguistically appropriate services. All right, now let's dive into the grant opportunity. So one thing I'll say at the beginning is this is new for us. So this is the first time that we've been able to provide funding to our community partners and community-based organizations within our region. So we're just getting our feet on the ground with this. We're really excited about the opportunity to provide funding to local communities and to really support community-driven work. So that's really what this is about. Our plan is to award up to $150,000 to each grantee. So we'll be making awards to one grantee in each of the 3 states. The estimated period of performance for this work is going to be May of this year through September of 2024. So that'll be about 17 months of work. We ask that all interested applicants submit a letter of interest by the end of the day on March 17th. So by 4 o'clock Central, 5 o'clock Eastern, we're going to be looking for those letters of interest. We will then get back to everyone by March 28th with an invitation to submit a full proposal. Whoops, sorry about that. Here we go. Full applications, full proposals will be due by April 21st. And then we are anticipating that we'll announce awards by May 18th. We'll try and maybe make that happen. Those awards happen a little sooner, but it kind of depends on how many applications we get and how quickly we're able to work through those. Okay, so again, what we're looking to fund with these awards is community-led collaborative approaches to reduce health disparities. We identified 3 communities, one in each of the states that we support for the quality improvement organization work. And we use data to identify the areas that are significantly impacted by health disparities. So Wayne County in Michigan, Ramsey County in Minnesota, and Milwaukee County in Wisconsin. We're looking to support projects that supplement and enhance ongoing activities and interventions to reduce disparities. So we're not looking for you to initiate new activities with this funding, given that you're going to have about 17 months to do the work. We thought it might make more sense for this funding to be used to really build on and strengthen work that you are already doing or that you have already identified as a priority in your community. The funding is going to go to one community-based organization in each county, but with the expectation that the work is being done in collaboration with partners across the community. So again, this is really meant to be a collaborative effort. And solutions, because this work is funded by Medicare, it's important that the work that you're doing address health disparities in the Medicare population. That doesn't mean it has to be exclusive to the Medicare population. So if you take a broad approach and are working to reduce health disparities in the adult population in your county, as long as the impact will be demonstrated in the Medicare population, that's okay. So it doesn't have to be exclusive to the Medicare population. Okay, so we're looking to support local organizations, healthcare providers, community leaders, folks who are coming together and have a good understanding of local community needs. Again, we really want this to be community-driven, informed, and supported by local organizations and residents who have lived experience and have an opportunity to contribute to the solutions and interventions that are implemented. Preference will be given to proposed activities that also demonstrate improvement in those long-term goals that I talked about. So if you're, proposing an activity that is going to reduce health disparities, and you can also show that it will improve management of diabetes, for instance, or maybe increase access to primary care for your community, that's definitely a bonus. So we'll definitely be looking for those kinds of activities that not only reduce health disparities, but also make improvement in some of those goals that I talked about earlier. The kinds of things that we won't fund, again, this is federal funding, so we're not looking to fund capital projects, no clinical research, litigation, loans, lobbying activities, organizations that discriminate based on age, race, ethnic origin, religion, sexual orientation, disability, or gender will not be included. So just so that you're aware of, some of those typical exclusions that apply to government funded projects. Okay. Eligibility and requirements. So again, this is open to community-based organizations that serve these 3 counties, Wayne, Ramsey, and Milwaukee. We're looking for entities that provide comprehensive services to populations or communities that are medically underserved. So a wide range of services. And again, the work is meant to be focused on reducing disparities and executed within the performance period of the project, which I actually think is going to be closer to 17 months. And as I mentioned earlier, Medicare beneficiaries need to be part of the community that is served by this work. The expectations of the organizations that are funded is that you will work in partnership with us to move this work forward. So each community is going to have a full-time quality improvement advisor who is assigned to work with you on this project. Now, I want to be clear, though, that the quality improvement advisor who is assigned to work with you is really there to support you and provide technical assistance, not to give direction about the work that you're doing. We're really looking to you to identify the priorities, the interventions, the way to go about doing the work. We're just going to be there to help you along the way, to help clear away any barriers that might come up. We can provide different kinds of training, like around, coalition building, quality improvement interventions, how to measure impact. So somebody who's going to be available to support you, but they're going to be engaged with you throughout this process. We also expect that awarded organizations will officially join the Superior Health QIO initiative. You don't need to do that ahead of time, but if you're awarded, that will be part of the process. And basically what that means is that you commit in writing to work together with Superior Health Quality Alliance to make improvement in your community. We'll host quarterly community health disparities partnership networking calls. So we'll bring staff or representatives of the 3 communities together to share learnings, to problem solve together. So on a quarterly basis, awardees will be expected to participate in those calls and potentially to bring partners to those calls as well. And then we'll do a wrap-up interview with all of you toward the end of the performance period so that we can really learn from you about the experience, how it went, what went well, what did not. As I mentioned at the beginning of this call, this is a new process for us. We hope to be able to expand it in the future. So we really want to learn from you about how this process works and what we might need to change going forward. You'll have access to a variety of resources that we make available to all of the Superior Health Quality Alliance QIO participants. So we offer webinars on a variety of topics related to those goals that I talked about earlier, as well as kind of cross-cutting topics like coalition building, the basics of quality improvement, how to use data, those kinds of things. So webinars, learning collaboratives, educational modules, targeted training. We also have a community engagement platform called Superior Health Connect, which we'll tell you more about. If you're funded, we'll bring you into that resource. It provides a platform that you can potentially use to work with your community, to share materials, engage in conversation, do networking with other Superior Health Quality Alliance participants. Regardless of whether you're selected for this opportunity, we welcome opportunities to partner with you. So we hope that even if you apply, if you submit a proposal for this opportunity, but you're not funded, we'll reach back out to you to say, we have resources, we have support, we have technical assistance available in other ways. And we'd like to be able to help with the work that you want to do regardless. Okay. The process and the timeline, I went over this briefly at the beginning. Letters of interest due on the 17th. Invitations to submit a full proposal will go out on March 28th. Full applications will be due the 21st, and we'll make awards announcements in May. The letter of interest is meant to be 1 page, single-spaced, 12-point font, kind of standard formatting. It'll be used to decide which organizations will be invited to submit a full proposal. We may reach out to you between March 17th and March 28th. If we have questions, if we get your letter and we need more clarification about what you're proposing to do, we may reach out to you just to make sure. I mean, you know, we want to get as many good proposals as possible. So if we have questions about what you're proposing to do, rather than just, you know, not invite you to submit a full proposal, we may call you to say, can you tell us more about what you're planning to do? We ask that your letters of intent include the following information. So your project title and organization name, and then a brief overview of what you're proposing to do and your population of focus. So the community that you're serving, the particular population of focus, and the need that you're intending to address. And I'll just say, with respect to the population of focus, it's absolutely okay if you want to focus on a specific subset of your community. So if you're going to focus on the African American or Black community, or you want to do a project that's specifically meant to improve health disparities in the Native American or American Indian community, or maybe the disabled communities. But so just be clear about who your population of focus is and what is the need that you're trying to address. Describe the work that the project that the funding will support, and then just a summary of those key activities and how you expect them to impact the population that you're serving. And then finally, you know, we expect this work to be collaborative. So so also include a description of the key partners and community members who are involved in this work. We ask that you submit those letters of interest to Jenna Kornberg in our office by March 17th at the end of the day. And again, we'll get back to all applicants by March 28th. At that point, we'll invite full proposals, which will be due March 28th. Sorry. We'll notify you March 28th. Full proposals will be due April 21st. You'll be able to access the RFP on our website, and we'll provide that information when we get back to you. Oh, and look at that. I was speedy. Okay. So maybe I will turn to my team first and see if there's anything that I missed. I don't know if maybe I should check.
Can you hear me okay?
I can hear you, Eva.
Wonderful. Well, hey, sincere appreciation for your grace as we manage those technical issues at the front end. Well, great job, Kim, getting through the content. We do have a few questions that I will assist Kim in reading off through the Q&A chat. Please feel free to continue to use the Q&A chat. I will be addressing this question. So the first question is, can only nonprofits apply? I'll say first, well, I'll give you my initial thought, and then we'll also send out official answers after the call. But my initial thought is no. I mean, really what we're looking for is it's community-based organizations. So if you are an organization in your local community that is, you know, you're embedded in the local area, you're seen as a resource by your local community partners, you can demonstrate that you have good partnerships with local entities in the community, we will certainly consider those proposals. Wonderful, thank you. And yes, we will be developing a Q&A document where we can further clarify those type of eligibility requirements. We have a couple questions asking if the slides in the webinar will be recorded and available. That is correct. We will be posting the recording along with the slides and the Q&A document
and will be sent to all the individuals who registered today, as well as being posted on the public website link that we will be sharing for you to share and keep within your network. The other question is, what is meant to be broader community? For example, if these services are for established clients, but the organization takes new clients, does that count?
Yes. I would say, so by broader community, I mean, we're really looking for projects that are gonna reduce health disparities within a local population, you know, in your county. So I wouldn't necessarily, I mean, I'm hesitant to say that that a project would be exclusive to a clinic population. So we should probably, we can provide some more clarity about this in the written response that we provide. But I guess the main thing is, you know, we're not necessarily looking for projects that are exclusive to the population served by your particular entity, or as I mentioned earlier, that are exclusive to the Medicare population. So even though this work is funded by Medicare, what we meant when we said broader community was that it's okay if the project serves a part of the population that's broader than Medicare beneficiaries. So let's say if you want to particularly do a project that is going to help reduce a health disparity for the Latinx community, it's okay if the project, you know, addresses the entire adult population versus just the Medicare beneficiaries in that population. So that's what we were really kind of just wanted to make sure we addressed when we talked about the broader community.
Thank you, Kim. What other responsibilities are attached to being part of the Superior Health Quality Improvement Initiative that needs to be signed after the grant is awarded?
It's other than the expectations that I outlined earlier. So, you know, we're obviously expecting that you're going to do the work that you outline in your proposal, and then that you will also work in partnership with us so that we can learn from your experience and kind of carry that forward and apply it as we do future work. So I think the question is maybe related to that requirement to join Superior Health Quality Alliance. Basically what that means is that you just, so when we are funded by Medicare, they ask us to officially enroll community participants in this work. And basically what that means is that you agree to work in partnership with us to address the goals that I outlined earlier. So you will, basically you're making a commitment to improve quality of care and patient safety in your community. We view that commitment very broadly. So in this case, if you're funded, that basically covers your commitment to work with us as Superior Health Quality Alliance.
Thank you, Kim. And if I just may add, you know, we see this relationship as a two-way street, right? We want to partner with you and learn from you so that we can potentially look to replicate this great work and the lessons learned somewhere else. And for the most part, this is a voluntary effort in terms of Superior Health Quality Alliance initiatives, right? So you will have access to all of the content and education, and it would be up to your discretion to join any additional you know, activities that can kind of alluded beyond the specific to this project and the RFP. So the other question we have, does the funding need to be spent down in the 18 months? Do you need to itemize reporting requirements?
I would say yes, we would like the funding to be spent in the 18 months. So our contract with Medicare ends at the end of October of 2024. So we won't have the ability to to do like carryover. That said, we are tentatively planning to award the funds. We're still working through this, but what we're tentatively planning to do is to award the funds basically in 3 buckets of $50,000 each. And we'll probably, I don't know, what I'm thinking right now is we'll do kind of one award immediately at the start of the work, another one at 6 months, and a third at 12 months. So we're not going to ask for the money back, but we do expect that you'll use the funds during the period of performance. So, and part of the reason that, this isn't quite as black and white maybe as you would expect or see with other grants is that what we're really hoping to do with these awards is work with you to make this process as streamlined as possible, to reduce the administrative burden, and to just give you the flexibility and freedom to use this funding in the way that works best for you. So, we're going to be working kind of hand in hand with you as this goes to support the work that you want to do. And we'll, as we make these awards, we'll also work with you to kind of understand what's going to work best for you in terms of how we get the funding out and make it available to you in the way that works best to support the work that you're proposing to do. So we're going to try and keep the reporting requirements pretty slim. Go ahead, Eva.
Thank you, Kim. Is there a specific number of letters of interest you are looking for?
Well, so with respect to the letter of interest, indicating your intent to submit a full proposal, we would expect 1 letter of interest per project that you're proposing to do. So we're not asking at this point, for instance, from like letters of support from community partners. That would be part of your full proposal. Right now, what we're just looking for is a letter of interest for the project that you want to be funded.
Thank you. Should the activities align with the overall goal of the QIA, care coordination, et cetera?
I mean, that's ideal. So our goal is to reduce health disparities in these communities. If the projects also address one of those long-term goals that I talked about, those proposals will definitely be given preference. So, if we have one proposal that is not likely to impact any of those longer-term goals, and we have another that will reduce health disparities and also potentially make improvement on one of those long-term goals, the one that addresses the longer-term goals is going to score higher.
Wonderful. Do you mean a community-based organization registered with the IRS as a 501c3 not-for-profit organization?
Not necessarily. Yeah.
Right.
So I think that's similar to the question earlier. Well, I think if you can show that, you're working with local partners and have gotten input from the local community in determining the priorities and the strategies that you're proposing to implement, we're open to different types of organizations.
Thank you for clarifying. If we had a prior program that recently ended due to the lack of funding, can this type of grant be used to restart the program or as seed fund to get it going to attract other supplemental funders?
I think so. That would make sense to me. Yeah.
Is there an email contact that we can reach out to you if we have questions? And that is listed in the RFP for now. If we could have you contact Jenna Kornberg, and we'll share that in that email follow-up.
Thanks, Eva.
Can you describe any data reporting that will be required?
Yeah, so I will loosely describe data reporting that will be required. So we recognize that 17 months is not enough time to significantly impact outcomes related to health disparities or those long-term goals that we talked about. I mean, we might see incremental progress. So really, I think what we're going to be looking for is probably a mix of process measures, engagement measures, things that let us know that you are, intentional and thoughtful about ways to measure the progress that you're making. So we're not going to expect that you're going to see, for instance, a 5% reduction in health disparities in a specific population over this period of performance. We just don't think that's realistic. But we want to get, we obviously want to get this work started, or help it continue to move forward, really is what we're hoping to do. And we'll work with you. I mean, so we'll ask you to include information in your proposal about how you propose to measure the impact of your work. And then we may work with you as we over the course of the performance period to say, what if we consider this, maybe consider another, there might be other ways that we kind of work with you to figure out how to measure your progress. But again, we'll be looking for you to be thoughtful about that in your proposal, but we'll also work with you to do the measurement as you implement the work.
Thank you, Kim. Yes, and I would say access to a data analyst that will be part of this team will be one of those benefits of the partnership with Superior Health. So absolutely.
Thanks, Eva.
Can an applicant submit LOIs for more than one project in the community with different purposes?
Yes. I mean, I would say look for those, look for opportunities to kind of link things together to coordinate across projects, if that makes sense. But otherwise, yes, you can submit more than one LOI.
Will we need to itemize our spending? For example, if we use staffing time, do we need to use time and effort reports?
I don't think so. We'll respond to that more definitively, but I think it'll be in more in bigger chunks. So sorry, that's not super black and white, but we'll get back to you about that.
Will sustainability plans be weighted as you consider applicants?
It will be part of the criteria that we use to consider the proposals. So it's, if I remember right, and Eva, you can correct me if I'm wrong, sustainability isn't like a big percentage of the scoring criteria, but we certainly want you to be thinking about how you're going to sustain the work.
Correct. And I think that comes in play in the actual application process for that round 2, where you describe your project description and population of focus. There's components in there that you will see that will kind of ask to address about what your plans moving forward beyond the 18-month scope would be. And I would also say this is a great opportunity for us to partner with you to towards the end of our time together to think through about what that sustainability plan looks like for this project moving forward. So I believe those are the questions, which again, we will collect and put into a more refined Q&A document. Want to make sure there's no chat, even though it has been disabled on your end. Yeah, it looks like those are the questions that we have. Unless there's any other last minute questions based on some of the questions answered, please feel free to continue to use the Q&A chat. If not, we would be happy to conclude the call and look forward to sending the recording and the documents after the webinar.
Eva, there is one more question that was asked earlier on, and it's the person's attending today under chronic disease management long-term care goals, and they are a provider working on a diabetes prevention program and wondering if that program improvement for that program would qualify.
Well, so what I would say is possibly, I mean, I think, you know, again, what we're looking for is our community-based collaborative approaches to reducing health disparities. So if you can show that you're working with community partners in the implementation of that work, that it's going to help reduce disparities for a population that is impacted by health disparities, then yes, potentially it would be a good fit. So, but it kind of depends on, you know, your ability to meet those other parameters.
And it looks like the last few questions, I think, were similar to the previous. Do you mean a community-based organization registered with the IRS as a 501c3, which again, we clarified, not necessarily. That we'll consider any, you know, organization that provides, you know, direct care services to the patient populations that we mentioned. All right. I do not
Okay.
see any questions, but again, there is a contact included in the RFP brochure for any additional questions. Please feel free, as you look through the content, to send them our way. And we will be sure that we get you in contact with the appropriate staff member to answer that question. So.
And we're so grateful to have you all here. We're really excited about being able to award these funds and about the potential to really support local community-driven priorities. And again, you know, we're part of this process. While we're excited to support your work, we're also excited to learn from your work so that potentially we can do more of this as we go forward. So you know, we really are looking to this as a partnership between you all and Superior Health Quality Alliance, where we're each going to be learning from each other as we improve healthcare and potentially access to care in our communities. So thank you all for being here. Thank you again for your patience with the technological difficulties at the beginning. And don't hesitate to reach out to us if you have additional questions. We'll follow up in the next couple of days with responses to the questions in writing, and with the recording from the session. Okay, anything else? Any final questions that came in?
Do not see any additional questions. So thank you all
Okay.
again. And
thank you all.
soon.
Have
Bye-bye.
a good day.